Hello, everyone. My name is Maui Herrera, and today I will be um, presenting my final disease project on the disease tetanus. So, what is Clostridium tetani? Clostridium tetani is a very common soil bacteria and the causative agent of tetanus. This bacteria can typically last months to years in soil, but cannot survive in the presence of oxygen. So this bacteria is almost everywhere, from soil, feces of humans and animals, ash, rusted needles, rusted nails, and so much more. So a fun fact would be that if someone is living on a farm or has livestock present in their backyard, they would more than likely have Clostridium tetani present in their soil and in their manure. So what is tetanus? Tetanus is disease that forms due to the bacteria that is Clostridium tetani. The bacteria invades the body mostly through wounds, scrapes, deep punctures, and also burns, and can spread quickly, causing many terrible symptoms and potentially death. With or without treatment, this disease can be fatal. Here we have some symptoms of tetanus, fever and sweating, headache, trouble swallowing, painful muscle stiffness all over the body, and the most common initial sign of tetanus is spasms of the muscles of the jaw, also known as lockjaw. So how is tetanus diagnosed? So unfortunately, there is no specific hospital lab test that can confirm tetanus. So doctors will have to make a diagnosis after considering the patient's symptoms, taking a physical exam, and viewing their tetanus vaccination history. It is still not uncommon for a doctor to have the patient undergo blood tests to make sure these symptoms are not caused by something else. So how does tetanus affect the body? So when the spores of Clostridium tetani bacteria invade the body through a wound, they become active bacteria that spread throughout the body through the bloodstream. So the poison that spreads in the body is called tetanus toxin, also known as tetanospasmin. The tetanus toxins affect the brain and the nervous system, causing a block between the nerve signals in the spinal cord to the muscles, leading to severe muscle contractions. These severe muscle contractions will often result in neck and chest muscle stiffness that, without proper treatment, will result in suffocation and lead to potential death. So here we have the prognosis. So the prognosis after tetanus depends on the time of the first symptoms the patient is experiencing. The tetanus infection progresses in a short amount of time, and regardless of treatment, 13.2% of cases are lethal. The prognosis is rather poor. Tetanus treatments are typically administered to patients to slow down the spread of the bacteria in the body. Because tetanus is not curable, the disease itself will only be treated to slow down the spread of the bacteria. And those who do become infected with tetanus will have to go through a long term recovery that could last for months or even years. And although patients may recover, they could develop hypotonia and autonomic dysfunction, if, of course, this is a severe case of tetanus. So here we have the misdiagnosis. So tetanus has a lot of similar symptoms to many different diseases and ailments. For that reason, it can be misdiagnosed, especially if a patient has not been up to date with their vaccination history. So some of these common symptoms are muscle spasms, trouble swallowing, and fever. Here we have a list of misdiagnoses: drug-induced dystonias, strike poisoning, meningitis, and also seizures. The most common misdiagnosis of tetanus is strike poisoning because it resembles the symptoms of tetanus the most. So there are some treatments for tetanus, and of course, the first step would be to clean that wound regularly until it heals to prevent the bacteria from spreading. Another medication for tetanus would be antibiotics, which help clear out the bacteria within the system. The next step would also be to take the antitoxin therapy, which will neutralize the toxins in the body and kill off the bacteria. For those patients who are suffering from severe muscle contractions, they would be administered muscle relaxers. And for tetanus, it is a long term supportive care that would be needed to be given to the patient. People who survive will still need tetanus toxoids because the infection does not grant immunity, unfortunately. So here we have some of the side effects of tetanus medication. So of course, those who do seek medical attention for tetanus and are diagnosed with the disease, they will have to go through a series of treatments, and the treatment will affect their bodies tremendously. For example, a patient who is experiencing severe muscle contractions and are administered um, sedatives, the sedatives will slow down the function of the nervous system to control the contractions. The most common medication for tetanus infection is the antitoxin therapy to target the toxins that have attacked the nerve tissue in the body. So, the side effects of this medication can cause a patient to experience chills, fever, and skin rash. And for those who administer antibiotics to help stop the bacteria from spreading and creating the neurotoxins that cause muscle spasm, they may experience side effects such as vomiting, abdominal pain, and so much more. So, luckily, there is a vaccination against tetanus, and to prevent tetanus, children will typically go through a series of tetanus vaccinations during their childhood. While this does help fight off tetanus, there are some side effects to look out for when getting the tetanus vaccine, such as fever, vomiting, muscle soreness, and nausea. So, tetanus vaccines do not provide lifelong protection, and after tetanus series booster are required and are, of course, recommended every 10 years. But it is not uncommon for a person to receive a tetanus booster if they've had a really bad wound, a really dirty wound, or a scrape, if they haven't had the vaccine a booster in 5 years to, of course, help with that protection against tetanus. So here I have my sources, and thank you so much for watching. I hope you have a great semester, and thank you so much for everything that I've learned this semester. Peace out.